Okay, we are live with another Ovadia Heart Health telemedicine live stream. Today, I have the pleasure of having as the guest on this live stream, Dr. Phil Ovadia himself. He will be talking about an article that he recently wrote and was published on the ifixhearts.com website and has driven a lot of interest. The article is entitled Lipid Values Your Doctor Doesn't Know About, and there's a lot of fascinating information. There's a lot of conflicting talk about this issue online and elsewhere. Before we start, I want to just put on the screen the medical disclaimer, which we do before each of these live streams, and I'll let Dr. Ovadia tell you what to expect and what not to expect with respect to education, information, and medical advice.
Yeah, thanks, Chris. Great to be here with you. As always, in this type of forum, we are not giving specific medical advice, and anything we talk about should be discussed with your healthcare team and your medical practitioners before you make any changes. And if you are interested in having my team be your medical team, so you can discuss things like this with us. That is always an option. And you can go to ifixhearts.com/talk to set up a discovery call.
Okay, well, with that out of the way, you write a lot of good articles, really good articles on the website, and they always get a lot of engagement and interest. But this article that was posted recently, last couple of weeks, on lipid values that your doctor doesn't know about, you started it off by saying that 75% of people hospitalized for heart attacks don't have high LDL. Why is this such a powerful wake-up call?
Yeah, for 40, maybe 50 years now, we've been told that cholesterol, and specifically LDL cholesterol, is the primary risk factor for heart disease. And that therefore, right, if you believe that to be true, the primary way that you are going to try and lower your risk would be by lowering your LDL cholesterol level. And, without getting into yet whether or not that statement that LDL cholesterol is the primary sort of modifiable risk factor that someone can pay attention to, when you see a statistic like the one that we talked about in the article, that and there have been various studies looking at this, and somewhere between 50 and 75% of patients that present to the hospital with heart attacks do not have elevated LDL cholesterol levels. That really needs to call into question whether, in fact, LDL cholesterol, the quantity of LDL cholesterol specifically, which is what you are looking at when you get a basic lipid panel, whether that is truly the primary risk factor for heart disease. Because if it's a 50-50 shot, honestly, that doesn't seem like a meaningful thing to pay attention to. And, like we said in the blog post, and like I've discussed many times, my observations as a heart surgeon mirrored the findings of these studies that we referred to, that many of the patients that end up on my operating table do not have elevated LDL cholesterol. Sometimes because they're on medications to manage their LDL cholesterol, and yet they've still ended up with a heart attack or on my operating table. Other times it's just patients that naturally, right, their bodies have not produced high levels of LDL cholesterol, and yet they still end up having heart disease. So this was one of the sort of high level facts that opened my eyes to the possibility that what I had learned, what I had been taught, as a medical student and throughout the first part of my career, that LDL was the primary driver of heart disease, might be wrong.
So why do so many doctors still rely almost exclusively on LDL cholesterol numbers. It seems like they would get the message after some period of time. What's going on with that?
Yeah, I think there are a couple of factors that come into play here. I think the sad reality is that, doctors want to do something, right? They want to help their patients. And heart disease is the number one disease, right? The number one killer. And so, there's a large focus on this. And doctors don't know anything to do except manage LDL cholesterol levels, right? That's all they've been educated about. Like I said, I came out of my medical school, my education, and my training believing that LDL cholesterol was the primary driver of heart disease. And honestly, I really didn't hear about any of the other factors that I now know to not only be involved, but are actually more powerful drivers of heart disease than LDL cholesterol. Things like insulin resistance and even things like inflammation were just not discussed. And, why aren't they discussed? Why aren't they paid attention to as much? Honestly, the only explanation I can find for that is that there is a large push by the pharmaceutical companies because they have an effective way of lowering LDL cholesterol with pharmaceuticals. We don't have that same pharmaceutically driven way of controlling things like insulin resistance or even inflammation, although there is now some focus on inflammation as another factor in heart disease. And there is actually a medication that is now approved, but that's actually an inexpensive generic medication that is now approved for the management of heart disease in patients with high levels of inflammation.
Oh, fascinating. Can you, the article talks, in the article, you mention LDL particles and how they vary in size and pattern. Um, and I suspect, based on what I've learned, is that a lot of people are getting a very basic lipid panel. And I understand that there's a lot more that you can learn from somebody's markers and panel. What goes into how does that play into the picture? And can you explain the difference between the large buoyant LDL and the small dense LDL and how that's important to an individual?
Right. And this is some nuance that many doctors don't understand. Because again, LDL cholesterol has always been sort of presented to doctors as one thing, right? It is one cholesterol carrying particle. And all we need to do is lower the amount of that cholesterol carrying particle known as LDL. And when you get your basic lipid panel, you're going to get your LDL level, which is the amount of LDL in your bloodstream. So think of this as is if we took your blood and we kind of pulled out all of the LDL and we put it into sort of one big ball, right? How big would that ball be? What is the mass of LDL within your bloodstream? And again, most doctors don't know to think about LDL beyond that. And what many doctors and certainly many people don't realize is LDL is not all one thing. It's actually a family of particles, cholesterol carrying particles, that can be sorted in a couple of different ways. But one of the ways we sort them is based on the size of the particles. So you can actually sort of think of it as spreading out all of the little particles that make up that big ball that we've now called LDL on your basic lab test. And now we can, first of all, count how many particles there are, and we can sort them by size. And we can determine how many are small, how many are medium, how many are large. We can determine what the average sort of size of your particles is. And that gives us more information about the quality of the LDL cholesterol. And this, it turns out, is what's really important about LDL cholesterol. It's not how much LDL you have, it's what's the quality of that LDL and what's the environment that that LDL is existing within.
So if two people have the same LDL cholesterol level, how can their respective risks be completely different depending on that particle size? And what is it about certain size particles that makes them more dangerous biologically?
Yeah, that is really the questions that we should be asking. So, we know that the small LDL particles, the small dense particles, you'll sometimes hear them called, these are what we call atherogenic particles. What that means is that they have the potential to form the atherosclerotic plaques that build up in the blood vessels and then can lead to things like heart attacks. Large LDL particles, sometimes called large fluffy or large buoyant particles, are not atherogenic. They do not, under any circumstance, get involved in plaque formation. So there's no reason to be concerned about large LDL particles. Now, again, when you just get your basic lipid test and all it's telling you is what is your LDL level, you have no idea. Do I have primarily small particles or do I have primarily large particles? To, come up with a practical example, right, of why this matters, you can have two patients with the same LDL cholesterol level. Let's say your LDL cholesterol level is 100 milligrams per deciliter, which is considered to be a pretty good LDL level. Well, that, that level, 100 milligrams per deciliter is the unit. You could have, let's say, 500 particles making up that amount, or you could have 2,000 particles making up that amount, right? And as you might guess, if you have a higher particle count, you're for the same level of LDL cholesterol, you're more likely to have smaller particles, right? You have the same total mass, but you have more particles. So therefore, each particle on average is going to be smaller, and that might be problematic. Whereas if you only have, let's say, 500 particles making up that mass, they're going to be mostly larger particles, and that is not going to be problematic. Now, the opposite situation is where we really get into some controversy, because you can have what most doctors would be considered a high amount of cholesterol. Let's say your LDL level is 200 instead of 100. And most doctors are going to say that's a very high LDL level. But let's say your particle count and your particle sizes show that you have mostly large particles under that situation. You are likely not at high risk, because even though you have a lot of cholesterol, it is mostly the good, the truly good, the non-atherogenic LDL cholesterol particles, the large fluffy particles. And therefore, you may not be at risk. And the other real danger I see is people that have a low LDL cholesterol level. Let's say your LDL level is 70, and all your doctors are happy that your LDL, your cholesterol is being managed properly. But it turns out that the majority of your particles are small particles. You are still at risk, and you are being given a false sense of security, because you still have a lot of atherogenic particles around, and they may form plaque. And that's a situation that I oftentimes see in patients that are taking medications to lower their LDL cholesterol, because many of the medications that lower our cholesterol levels, they disproportionately affect the large non-atherogenic particles, and they leave behind too many of the small, dense particles. And these are patients that I see get into trouble, and they develop heart disease, and they were under the false impression that their risk was being managed adequately.
And what about what are some of the steps that someone can take to improve their risk with other means, like addressing the insulin resistance that you talked about, addressing the inflammation, and are there any other things like triglycerides and HDL? Where does that fit in? And is that something that people should be paying more attention to rather than simply going to a statin?
Yeah, so this is the next step in the process, right? Once we understand that the quality of the particles is what matters, the size of the particles is what matters, we then ask, well, what determines the size of my particle? And what should I be doing, to shift that size and lower my risk, right? And it turns out that insulin resistance is a big, big factor when it comes to the size of your particles. The more insulin resistant you are, the smaller your particles are going to be. And in fact, insulin resistance is such a powerful predictor or influencer of the size of your particles that there is actually a test that works backwards and looks at the sizes of your particles and determines how insulin resistant you are. That test is called the LPIR test, the lipoprotein insulin resistance score. And that's a blood test that you can get to help determine if you're insulin resistant, and you're also going to see the size of your particles. So doing something about insulin resistance is going to cause your particles to shift towards being larger and therefore lower your risk of heart disease. This is one of the reasons, not the only reason, by the way, that reversing insulin resistance lowers your risk of heart disease ultimately. Another influencer of the size of your particles is going to be the types of fat that you are consuming. It turns out that eating saturated fat, which of course we oftentimes find in animal fats, causes your particles to be larger. Eating polyunsaturated fats, things like vegetable and seed oils, causes your particles to be smaller. Now, generally eating polyunsaturated fats in vegetable and seed oils lower your cholesterol levels, your overall LDL, your overall and your LDL cholesterol levels. So it's interesting, again, doctors and the American Heart Association, for instance, will largely recommend eating using vegetable and seed oils because it's going to keep your LDL cholesterol level lower, but you are likely to be increasing your risk because you're driving your particles towards smaller particles when you consume these things. And the opposite, right? The saturated fat that we've all been told to avoid because it can contribute to raised LDL cholesterol levels actually gives you larger, healthier LDL particles and therefore maybe lowering your risk. So these are a couple of examples of how we've been sort of led down the wrong pathway, because if you're only looking at the LDL level, you get an incomplete picture of the risk that's going to be associated with your cholesterol profile as a whole.
Excellent. Well, so it's so fascinating, the information that you can learn. I just got news that our link, ifixhearts.com live stream is working well. And we have, I'm going to put this a little bigger just so that people can see. If you want to get a free download of Dr. Ovadia's book, Stay Off My Operating Table, just go to ifixhearts.com/livestream and you can get a digital download of the book. It's extremely informative and it gives you a lot of information. We'll also send you a link to the article so you can read the whole article. I have a few more questions, and I'd also love to know if there's any more things, Dr. Ovadia, that you think a patient should know. I think a lot of patients go to their regular mainstream doctor and they get their very simple lab numbers. They get told they have high LDL, and the next thing is that they have to get statins. Some people just take that recommendation without any further investigation. And what are some of the negative aspects that can come about through statins?
Well, there one of them I mentioned already, right? That when statins lower your cholesterol level, they disproportionately lower the large particles more than the small particles. So they actually may be shifting you towards a more atherogenic uh, profile, a more atherogenic lipid profile, because you're going to have more of those small particles left behind. Um, Possibly related, right? But another concern around uh, statins is that they have been shown to worsen insulin resistance. They have been shown to make patients more likely to develop type 2 diabetes when taken for more than a couple of years, for instance. And, again, the worsening insulin resistance may explain some of the shifts that we see towards the small particles when patients take statins. But given that those are drivers of heart disease, insulin resistance, and more smaller particles, those are kind of concerning effects from a medication that's supposed to be lowering your risk of heart disease. Um, Ultimately, uh, again, what we advocate for in my practice and what I talk about a lot on social media and, in appearances, right, in talks that I give to other healthcare practitioners and, at conferences. If you get rid of the insulin resistance and you get rid of the inflammation, it's likely that your cholesterol is no longer going to be problematic and you may not need to lower it with things like pharmaceuticals.
Talk a little bit about those lifestyle changes that Ovadia Heart Health strongly advocates for, and the fact that our mainstream system, through no fault necessarily of individual doctors, but the time limitations and some of the constraints that are placed upon them as part of the system. Talk a little bit about those lifestyle things and how important they can be in reducing heart risk, and how neglecting them and just simply taking a medication could be counterproductive.
Yeah, so we believe them to be vital to your heart health and to lowering your risk of heart disease. And, we really talk about four main pillars, which is what you're eating, what you're doing, your activity, how you're sleeping, and how you're managing your stress. And, all of these have contributions in different ways to improving your overall health, your metabolic health, and specifically your heart health. And when you work with our team, right, we're going to take a comprehensive approach. One of the main sort of criticisms I have around the management of heart disease, forgetting about whether or not the cholesterol narrative is correct or if it's incorrect, right? We'll put that aside for a minute. It's a very one issue way of looking at heart disease. And heart disease is complex. So to think that we could reduce it to one factor, one blood test, and therefore, that just by managing that one blood test, we're going to be effectively managing your risk of heart disease is really a foolhardy concept. And this does need a comprehensive, holistic approach. And that's the approach that we take here. As many in the audience maybe are aware of, but maybe not, right? When you sign up for an appointment with me, right, as part of this practice, you're going to get probably 3 to 4 hours of FaceTime with coaches like Chris, and we have two other coaches currently in the practice, Krishna and Jen, my nurse practitioner, Lisa, and then me. My average appointment time for a new patient coming into this practice is 1 hour, as opposed to the 15-minute appointment times that probably most people have experienced when they go and see a doctor that's sort of trapped within the mainstream insurance system. So there's a big difference. And because we spend more time with you, we have the luxury of being able to discuss all of those holistic issues, right? All of your diet and lifestyle issues to really help you understand how best to lower your risk of heart disease.
You can reach out to ifixhearts.com/talk if you'd like to schedule a free consultation with our metabolic health coordinator, and you can learn all the options about working with Ovadia Heart Health. And I want to put that link again on the screen for anyone that's listening today. Go to ifixhearts.com/livestream. The link is right there on the screen, and you will get a free digital copy of Stay Off My Operating Table. And we'll also send you a link to the article that we've been talking about today. Are there any other thoughts that you'd like to leave the audience with, Dr. Ovadia? Anything that you think is valuable as a last parting words?
Yeah, it's really just the basic philosophical thought about if your doctor is saying to you, just take the statin, right? Just lower your cholesterol. Really, you should push back and say, is heart disease that simple? Are there other things that we should be thinking about? Is this one simple blood test, my LDL cholesterol level, really enough for you, the doctor, to help me, the patient, understand my risk of heart disease? And if your doctor just simply doesn't know how to go beyond that, right? What some of this other testing might be, and what some of these other factors are that come into play when you're talking about managing heart disease, that's an indication that you may need to find another doctor. And there are so many good ones out there. I always encourage people, check out the Society of Metabolic Health Practitioners, for instance, that has a comprehensive directory. Come see if working with me and my team might be the right option for you. But find a practitioner, a healthcare team that can help you truly understand and manage your risk of heart disease.
Well, thank you so much for enlightening our audience and myself. And I really appreciate being part of this team. Again, last chance for anyone listening. If you want to get a free copy of the digital download, go to ifixhearts.com/livestream. And I guess that's a wrap. Thanks everybody for coming. We appreciate you joining in, and we'll talk to you next time.